Good afternoon, everyone. I, Dr. Kunalrajyan, founder and director of the Dental Home Overseas Academy, would like to welcome you all for the ADC session today, that is, for Australian Dental Council exam. We have organized today's session for all those dentists who aspire to hold a license and work as a practitioner in Australia. So, a brief session on initial assessment, part 1 examination, that would be theory, and part 2, that would be practicals. Lastly, about our academy, the dental home, which is based in New Delhi, India, has been running from last 9 years, giving a platform to dentists all over the world for not only ADC but also many hands-on programs like general dentistry course, rotary endodontics, dental implants, soft tissue lasers, and more. Thank you, everyone, and I wish you all the best for today's session. Handing over to Dr. Ankush, who will be giving you an overview for the same. Thank you.
The dentist in Australia, how the dentists in India, they are like they're understanding the situation. Oh, sorry, in Australia, how they are handling the patient, how they are talking to the patient. What thing is important? Like if I have to ask you a question, you are in pain, right? So what will be my first information gathering about it? So it will be about pain. I will be asking you about. So if a patient comes, he is having a irreversible pulpitis. He hasn't slept whole night. No medication is helping him, and there is a swelling on the face. So the first question will be, what you are going to ask. First complaint of the patient is pain. So if I'm going to ask the patient, I'm going to ask about Socrates. Socrates is a mnemonic for pain. So I'm going to ask about the source of pain, right? So accordingly, we will proceed. This is a like clinical understanding. Though there is a swelling on the face, it's also important, but it will come secondary. The reason being, the patient's first demand is why I'm having the pain. I have to address that concern first. Then will be the swelling. I hope your question is answered. Dr. Vashar, once we pass the written exam, for how long we are eligible to take them? Okay. For the practical exam, you are uh, eligible for 7 years. Oh, sorry, 3 years. You have to clear the exam in 3 years, and majority of the students they do like in 1 or 2 attempts. They do clear. But that means that you have to prepare a lot. You have to put in efforts, and the your initial assessment will be valid for the next 7 years. Any other questions you have? Once we So these are the questions that a few of the examples, these questions are there. So if we look at the scenario, Dr. Ishita has asked a question, sorry. How much minimum balance in bank account do we require in order to apply for the visa for the exam? Dr. Ishita, I might not be the right person to answer that question, but in my experience, what I've seen is like I was sponsored by my brother. If you have any brother or sister or any uncle or even a friend over there in Australia, they can sponsor you. In that case, you don't have to show any money. And even in my case, I didn't underwent any medical examination as I was sponsored by my brother. So he was taking care of all my expenses from lodging to food and everything. And if you do not have any person or any friend over there in Australia, then you have to show around like 8 to 9 lakh rupees in your account. That can be FD, that can be in your bank account, or your parents can also take responsibility for you, or your partner can be taking the responsibility. So it all depends, right? So the visa guy we have with us, after you clear the part one, we will surely help you with those, and he will be very happy to help you. And Dr. Rahul asks, how many attempts for practical exam? Well, you can take this exam twice a year, practical exam twice a year. So I would say there are 6 attempts. So generally in 2 attempts you will be through. But I would say like prepare will try to help you in such a way that you clear it in one go. And I'll be very happy to see you working over here, Dr. Rahul. Dr. Varsha. So when I was in my third and final year, I couldn't practice due to COVID. So the practical exam, what should I do? Oh, don't worry about that, Dr. Varsha. Um, I told you I didn't practice dentistry for 5 years, and after that, I cleared this exam. So it's not big deal. Don't worry about that. Can we apply for loans? Dr. Ishita, I couldn't understand the question. Can you be more specific regarding the visa? Regarding the visa? Okay, okay. So even no, you don't need to do any further studies. Once you are done with this ADC exam, then you can directly work as a dentist over here, and you will be having a very comfortable, like, uh, if I say the basic income or the average income in Australia is around like $65,000 per year per person. And as a dentist, you start around like 2 to 2.5 lakh dollars a year, and you go up to like there's no limit. Like the more the practices you have, the more amount you will be earning. Any
Sir,
other
we
question?
heard that in, yeah, sir, we heard that in Australia, European
Mhm.
people are coming too much. So again, there is a job recession for
Oh, actually,
dentists.
yeah. See, actually, what happens is these are the half-cooked informations. So why I'm calling them as the half-cooked informations? Because what happened is some of the people who are coming to Australia, they are coming onto the courses like cookery or to the carpenter, right? Or they're coming on to the jobs like MHAs or MPH, even though they are dentists or like from other professions. So what happens is there is a overload of these immigrants, and the Australian government they have certain quota for every stream. So suppose there is a quota for 100 people for MHA, but everyone is coming to Australia on MHA course. Like suppose 1 lakh people came, they're going to give PR only to 1,000 people. They are not going to give to the remaining people. But at right now in Australian market, there is a recession of dentists. That is, there are very less number of dentists as compared to what Australian public requires. Single dentist over here, even what I have seen so far is like a single dentist is owning like 5 to 6 practices on average, who has worked here for 5 to 6 years. So they are owning like 5 to 6. Every year they open up their new institute, and they are partnering with a new like when you will be a new dentist over here in Australia. So at that point, if I'm planning to start a new clinic, I will be saying that please come in and join with me, right? So this is what is happening over here. Recession is there. I agree that there is job regression, but that is for other professions. Dentistry right now is in demand, and how we come to know about this is there is another factor. If you go and open the immigration website and you see over there, so if you go through those, the dentistry is into the skill shortage list in some of the provinces, like in Perth, in Brisbane, in Adelaide, in Canberra, in Melbourne. So we are in recession right now. They need more dentists. So that's why a lot of dentists, especially from the south of India, they are applying a lot. I have seen in like in the last 4 to 5 years, I've seen like even if when the majority of the students are going, they are either from India or they are from the Arab world. A lot of them are applying. Even those who have like gone to the Saudi to work as a specialist or someone, they are also applying as like they are even I personally know some of my students who are trying to take this exam part two for Australia. They're well settled. They've been over there for like last 10 to 15 years. Their families are over there, but now they're moving to Australia. Vasha, sir, I'm very scared for the practical exam. I just know things theoretically, but never practice. So how we will be able to? So what happened? Sorry, hold.
Sir, your voice is breaking.
I'm really sorry. Just can you give me for 2 minutes break? Just sorry. My niece is over here. Just sorry. I'm really sorry for the break. Uh, so where we were? Hello.
Dr. Ishita's question that she hasn't practiced, she knows things theoretically.
Okay. So well, even like so the standards what we are following over here in Australia are completely different from what is practiced in India. So there are certain rubric that needs to be followed, right? So it's better if she is not very comfortable with these things because someone who is a specialist, like even I have experience when I didn't practice for 5 years. I completely forgot everything about dentistry. Like I was very scared to even hold the air rotor in my hand. But the day I started, it took me just 2 weeks to come back to that point. And what best happened in my case was like I was totally blank and I didn't have to unlearn anything. Like who is someone who is a specialist or who has been working here for 10 to 15 years. I say they are at disadvantage. This is my point of view. Why? Because they have learned certain things in their life. They have experiences. So they have to forget all those things and then they have to start blank, then again start new thing. So I have seen in my case like there are prosthodontists, and I have seen one of the worst crown cuttings from a prosthodontist. So they have to unlearn all the things they have learned in their life, and they have to start thinking. They have to start following the Australian standards. The good part about us is like we are working over here, so we know like what is required, how much is required, like what to follow, what Australian Dental Council requires. So if you are not practicing or you are in some other profession because of any reason, so that is the best thing for you because you can get onto that thing on the day one of your practical preparation. The other person who has been working here for like for 5 years or 6 years, they have to unlearn the 5 years experience, and then they have to come at the level of the person who is not practicing at the moment. I hope your question was answered, Dr. Uh, Varsha and Dr. Ishita.
So, sir, I just one more doubt. If I never practiced RCT here, okay.
Mm-hmm.
So if I plan to write the exam in next year, so I have
Mm-hmm.
time. Should I
Okay.
need to take some general dentistry course in order to learn RCT?
Well, at this point of time, if you're thinking of taking the part one exam, then you don't need as such the like to practice like any RCTs or anything. But if you want, like, if you want to continue with the practice, then you can do. But if you right now, if you are planning to take this exam, then concentrate on the theory part, do that theory part, and then there is a practical exam pattern in which there is only access opening. There is no RCT. So the access opening, what the endodontists are doing over here and what it is done in the Australia, you will be
It's totally
because in the
different.
because what we are doing in the patient, like there will be attrition, there will be caries, there will be already access opening, right? So that is
Yes.
totally different. But what we are doing in on Australia, they will the whole exam will be on mannequin, right? So the mannequin will be having a special Ivretine teeth or special RCT teeth. So we will be doing in the ideal condition. So the access opening that we have read in our books, like I guess for what I have read was Walton and Student during when I was in college. And there was another that blue colored book. I don't remember right now what its name was. So it had that triangular shape appearance, the trapezoidal appearance, everything. They are going to follow that in Australian
Okay.
Dental Council. So don't worry, but in even in the Australian Dental Council, it is only 1/6 and 2/6 that are coming in exam. There is no other access opening that will be there. So when it's time to take the practical exam, we will make sure that you are apt enough. You are you are able to handle those things in a appropriate way. And also about the amalgam restorations, that will be difficult ones. You will we will be using very high quality permite amalgam that costs around 9,000 rupees right now in the Indian market. So for 50 capsules, so that will be used, and they're very high quality materials on which you will be taught. So don't worry, everything will be taken care of. At the moment, we need to start with the part one, and we are hoping that some of you will be joining us in the next session that we are going to start, and everything will be helped. Don't worry about that. And we have Dr. Vinisha and Dr. Kunal with us. They will be also helping you out in any way possible, any queries, anything. We will be all there.
Sir,
Dr.
since
Ishita is
I
like,
joined late,
sorry, you have any question?
I joined late, yeah, sir, I joined late, so I missed the part. I might have missed the part. I wanted to know earliest when can we write part one? And the
Oh,
literature you will be providing will be enough, or do we have to study from books as well?
okay. So, sorry, can I know your name, Doctor?
Shraddha.
Okay, Dr. Shraddha. So we will be providing you with some of the articles that are published by the Australian Dental Council, the Australian Dental Journal, or they will be from the British Dental Journal or American Dental Journal. So these are the best practices that are practiced over here. And then there are certain books that we will be giving you we will be making a folder into the Google Drive, and we will be giving you those folders. So if you read only those stuff, that will cover around like 90% of your exam. And I can assure you from my experience that majority of the exam will be from those things. And plus, I will be giving you some questions. Like these are the scenario based questions that are present in front of you on the slide. So we will be giving you around there are 200 to 300 scenarios. So we will train your mind in such a way that you will be able to think and apply those concepts onto the exam that we will be conducting, right? The Australian Dental Council will be conducting. Dr. Ibra, yes, it is online. It will be through the Zoom meetings only. And fee structure, Dr. Vanisha will be telling you about that. And because she's handling all those things, and she will be the right person to guide you accordingly. There are a few packages that I know of, and she will be telling you in detail about those. Any other questions?
Sir, I am government employee here in India.
Hanji,
So
ma'am.
any paper I need to get from the institute? I'm
No,
faculty
ma'am.
here.
Okay, ma'am, no issues regarding those. But when you are going for the practical exam, then you just need to have that written that I'm going for the exam, and I will be coming back and joining soon. So that will help you with your visa, because you are a government employee. The immigration law will be looking into your record, and they will see that there is a possibility that this person will return back to India after taking the exam. So your visa clearance chances are higher as compared to other candidates, as you are a government employee. Only in that part it will be helpful. Otherwise, either you are a businessman or you are not doing anything at the moment. They are not concerned about that because part one will be in India, and once you are done with your part one, we will be helping you with the visa application, and everything will be handed to you, and you can easily take that exam. A lot of teachers, tutors, sorry, the people who are here in government institutes, or they are faculty members. They are even personally, I know that there are some people who are working as MDS and HODs in Devangiri, then Ponta Sahib. Uh, in one institute is in that Gurgaon or Delhi area. So actually over there, they have been taking this exam, and Dr. Shraddha, there's nothing like that. You can
Yes,
take
sir.
this
Yes, sir.
exam.
Okay, sir. Thank you, sir.
No worries, ma'am. Dr. Ibra says, can we apply for the part one from Australia? So yeah, sure, Dr. Ibra. There will be centers. May I know which area you are? Which part of Australia you are? Auburn. Auburn is in. It's near to, I guess, Melbourne. Yeah. So yeah, in Melbourne there are there will be 3 to 4 centers. One will be in Clyde. Last time there was one was in Barrack. One was in Clyde. Uh, they will be like in almost all the cities. And then there was another one that was quite away from there. Dr. Priyanka is, so can you please elaborate? Okay, Dr. Priyanka, actually, sponsorship means I know about this thing because I went through the same process. My brother is working over here. He's a pediatrician. So what he did was when I have to take this exam, so he sponsored me, and he wrote in the sponsorship letter that he will take care of all my expenses, fooding, lodging, and he will make sure that I do not work without a valid work permit. And that was written to the Australian immigration authorities who were dealing with the visa process. So what they did was they didn't ask me any question. I just received a phone call from the immigration that was in India, Australian High Commission, and they called me up and they asked me a few questions that is regarding my stay, who will be taking the expenses from me, how I will be managing all the expenses and everything. No other requirement. They just verified what was written into the letter. So after that, I didn't have to show any amount of money. At that point of time, I had very less amount in my money, like around 2-3 lakh rupees in my account. They didn't ask me about my expenses. They didn't ask me about the flight tickets, nothing else. Everything was managed, and I got the visa for 3 years, I guess. Sponsorship is when someone from your blood relation or a close friend or a family member who calls you, who takes the responsibility for your immigration, that he will be held responsible if you cheat the immigration or you do anything fraudulent. So he's the sole person who will be responsible for everything. So that is called the sponsorship. He has sponsored you to come to this country. So is there any plus point for me? Well, Dr. Ibra, unfortunately, the there will not be any help in the examination, but the best part is that you don't have to go through the PR process, right? And there will be more job opportunities for you. As you are a PR holder, you already will be in Australia, so you can you will be easily apply for jobs like in dental setups. So you will be getting advantage in that part. The other students, like if I'm coming from India, then I have to look for, I have to apply for for the job opportunity. And in that process, what happens is I will be given a salary which will be comparatively less than yours. If you're getting 2.5, I will be getting around 220. So that's a benefit you will be having. Any other questions? No worries, Dr. Ibra.
Hello, sir.
So,
I'm Dr. Introductory.
yes, doctor.
Yeah, I was attending your workshop in between. So I
Mhm.
have one, like I'm a practicing here in India. I have a good, reasonably good practice, but I'm planning to move
Okay.
for better quality of life. So I have two
Mhm.
kids, like one is in fourth standard, other is in like
Mhm.
UKG. So like,
Okay.
will the adjust over there? Like education it will be different here and there. Will they understand whatever will be taught there? Like if I do clear the exam and go over there.
Mhm.
And this is one thing. And other thing is if I do clear the exam, theory, practical both, is there
Mhm.
any possibility that still we don't get job in Australia or anything? Because after such a hard task, if we still struggle, then it's a big problem for us.
Well, doctor, thanks for bringing up the question, and it's a really good one. Yeah, I can understand. Like, I'm very happy that you have two kids, two beautiful kids. And regarding the education over here, unfortunately, I'm single at the moment. I have no idea about it, but my brother is over here. So
Okay.
what I've seen is like education system is better over here.
Okay.
Because they in India, what I have understood so far is they are overburdening the students with the
Yes.
irrelevant knowledge. That's not going to be helping with this, right? But
Hmm.
in Australia, they are very sensitive. The people are very sensitive about the life. So
Hmm.
the teachers over here, the education system is like the curriculum is made in such a way that it helps you in the best possible way. I guess
Hmm.
Dr. Ibra is she would be you can talk to her like she would be better person to explain you about like the difference between the education system and over here in India as well as in Australia, because what I've seen is the people, the best thing,
Hmm.
whenever you walk onto the road in Australia, they will
Hmm.
wish you, "Hey mate, how are you?" And
Yes.
that is a very good quality, and
Yes.
that is inculcated into the school system. They are learning from that. And
Okay.
once you tell them, "Don't do this," they will be like, "Okay, sorry."
Hmm.
So that's a like they make human beings, not the educated fools, but the human beings, educated human beings.
Yeah.
So they will be very nice. Education system is perfect over here.
So kids.
Secondly, the advantage
Yeah.
would be like
Hmm.
you are in future you are also planning that your children should study from universities, right? So right
Yeah.
now we have moved to the Mindari area or Joondalup area in Perth.
Hmm.
So from here the Curtin University is very near. So
Sir,
the same
you are
question you are having,
you are in which area in Perth, sir?
Joondalup, Mindari Beach, near the Mindari Beach.
Okay,
So
sir. Okay.
yeah, so what happens is the Curtin University is at stone's throw from our house, right? So what
Okay.
questions you are having right now? My brother, who was practicing as a pediatrician over there in Australia, or in
Okay.
India, he moved over here, and now he's planning like I will construct a home near to the university so that our niece, she has like ease to go to the university and return back to the like
Okay.
over here. And even I know some GPs over here who have
Okay.
moved here in their life at the age of 45, and their
Okay.
children were like about to, like they were of your age, and their children were about to go to the universities. So one of the daughter is doing MBBS right now in the Curtin University.
Okay.
Then regarding yours, can you repeat your second question, sir?
Like, is
Okay,
there any clear the exam and still there is no scope and all those things?
well, no, sir. There's right now there is a shortage of dentists in Australia. That's
Okay.
why if we go into the immigration, we go for the immigration sites. So they have specifically entered dentistry into the skill shortage. So only then, because uh, majority of the people right now in India or any other part of the world, so they
Okay.
are taking the easy path. So what they do is they take a student visa and go directly to Canada. But
Okay.
right now, the competition for dentistry in Canada is too high. Like even the initial assessment takes around like 12 months. After
Okay.
that, you can plan to take the exam. So in my life, I haven't seen if anyone is not getting the job. Everyone gets a job in Australia, like every dentist.
Okay. Okay. And sir, to whom should I contact? Like you said, no, I can contact someone for regarding knowing the education you name.
Yeah, Dr. Ibra, she's another candidate and she's also an aspirant. And as she told, she's a PR over here. And I'm thinking like she will be having more knowledge than me regarding the same. Is it Dr.
Okay.
Ibra? If you
Okay.
can help Dr. Saab with this, it will be really helpful.
Okay. Thank you. Thank you, sir. Thank you.
Any other questions, sir?
So this is achievable. The exam is we can clear it. It's not an unachievable dream.
It's everything is achievable, doctor. Everything is achievable. You have to make up your mind.
Hmm.
Just think I have to take the exam, and I would say like if you're having a very good practice, it's really good. It's really good.
Hmm.
But make sure that before 1 month before the exam,
Hmm.
dedicate a majority of your time to the exam. Because
Yes.
at that point of time, the constant revision, even I will
Yes.
be like make sure that I complete the syllabus 1 month before the exam, and in the
Yes.
last month I will be doing extra sessions so that we have a repetition of things. Because our objective is not just to like start an institute and take the education. Our
Hmm.
objective is to get the higher percentage of students cleared. Second, as
Hmm.
I will be like in the future, if I'm planning to like make our own team
Hmm.
of dentists over here in India, in Australia, so that we can
Hmm.
expand, we can grow as a family together. So these are
Hmm.
the objectives. So once we are like in connection with each other from the very beginning of the journey, so the end
Yes.
is always good, right? So
Okay.
this is my vision regarding everything,
Hmm.
what I'm
Yes.
doing. So this is my plan, and we can start this journey together. And I will be very happy to help you in any way possible.
Hmm. Okay.
Sir, so a nearest date of exam will be expected date for
Uh,
this group?
for the exam,
Yes, sir.
uh, right now, the September exam is will be held. In after
So we
September,
won't be
there will
able to
be
catch up.
yeah. Right now, our first initiative is to make a ADC connect number, right? So what you have to do is this: we have to start with the process of initial assessment. So starting with the initial assessment will be like we have to register with the ADC, that is Australian Dental Council. So what we can do is we can log on to the Australian Dental Council website and start with the ADC Connect. And now the good part is everything is digital. You have to upload your DMCs, your transcripts. Then there is a good standing certificate from the dental council wherever you are registered. And all these things, there is we will send you the list of those, and there will be a picture of a passport size photograph that needs to be uploaded. Then once you have done everything, then they are going to take around like 2 months, 1 to 2 months for two, like they have written for 8 weeks. That is around 1 to 2 months. And then during that period, they are going to generate a special number for you that is called as the ADC Connect number. That will be your registration number. Once you are done with the registration number, then they will generate an email. Yes, now you can apply for dental exam. And if you start this process at this point of time of initial assessment, hopefully you will get the date in March. So there are two dates, March and September. This exam is held in March, the first week of in March, and the mid of September, twice a year. For the part one. For the part two, it's
Sir,
every month.
so for this, so for initial assessment, any college of India is accepted. Like
Yeah,
I tried online, but like my private college was showing that this university and college is not there in the list. They say that
Uh,
global dental college list should be the
yeah,
preferred list.
yeah, that is a preferred list. Then you have to uh, because the ADC they do have their own list. So what you can do is there are two lists. One is the global list, and another is what is recommended by the ADA, that is the Australian Dental Association. So you can what you can do is you can write to the Australian Dental Association and know about. Can you tell me which institute? What is the name of your institute?
So my graduation institute is from this Bareilly Rohilkhand University, Pothiwal Dental
Hmm.
College, Muradabad.
Okay, okay. So I guess from Moradabad, a lot of students have applied. It will be on the list, I guess so.
So I might be wrong because I tried, but I couldn't find my college or university's name in that Rohilkhand. So
Okay.
that is the first part. The dental home academy can guide us, like whether we can do initial assessment or not, and what will be the
Um,
charges of initial assessment
uh, well,
expenditure.
yeah, I guess for the initial assessment, they are charging around $600 Australian, uh, Australian government, the Australian Dental Association. But first of all, we need to see if the college is on the list or not. Then we have to search it. What you can do otherwise is you can write to the Australian Dental Association, our email address, our email regarding the same concern, and they can check it for you, and they will revert you in the as soon as possible. Generally, they do revert
So,
on Monday mornings.
yeah, so can you please share that email?
Well, I will send to the academy, and what we can do is we can make a WhatsApp or a Telegram group, and we will share the information over there, so that if
WhatsApp group.
any other person, yeah, if any other person having the same concern, they can also write a mail, right?
Yes,
Dr.
sir.
Ibra, we will be taking yeah, you can talk to the academy, right? And they will be answering you these questions. Like they have the whole list. These, I guess, these charges are all which are with the Australian Dental Association. I'm not sure like if the academy is charging for anything or not, but what I believe is it's all about like Australian Dental Association. Any other question regarding ADC, if anyone has?
Sir, how much time it takes for the PR? So 2 years it takes up to the exam. If we stay there for two
Uh,
years.
Sorry, sir. Can you repeat the question?
Like if we clear theory and practical both, how much time it takes for getting the PR? Around 2 years, you told. If we stay and
Sir,
work.
Doctor, there are two methods. So
Okay.
first of all, once you clear, suppose you clear the exam today, right?
Okay.
So
Okay.
after this, there will be a wait period for 6 months because you have to register over there in Australia. Then you have
Okay.
to come on a tourist visa once over here in Australia. And from
Okay.
any province of Australia, you can apply for the registration with AFRA. AFRA is the Australian, it is AHPRA, Australian Health Practitioners Regulatory Authority, which is regulating both MBBS as well as PDS doctors. So they take around like 6 to 8 months, and you once you get the registration, right, then you can move to Australia. After getting the registration, there are two methods. One is the 491. In
Okay.
this, you can go to any territory, any rural area or the suburb of like not in like if I'm in city Perth city, I
Okay.
can work in some suburb like Bunbury or Basildon. They're wonderful areas. You can go over there uh, and work over there for 2 years, and you will get the PR automatically, right?
Okay.
Other
Okay.
thing is, while you are in India, you apply to certain state. Like suppose you apply to Adelaide. That
Okay.
I'm interested. There is a skill shortage, and I have cleared my exam. I want to come to this state.
Okay.
So they can directly send you the PR. Then you can go to the Adelaide and work there But there is like a loophole in that. Like you have to stay in Adelaide for 5 years.
Okay.
If any state is giving you PR direct, then you have to stay there for 5 years.
Okay. Hmm.
So this is what there is.
Okay.
But I would say that the person we have with us in our team, I will be shortly talking to them about all these things. They will be helping us with these things in future. Okay, Dr. Shraddha asked after license also, you have to collect CDE points. No, the CDE points are not valid in Australia. Doctor, what we call over there here in Australia is continued dental CPD points. That is the continued professional development. So in this, what happens is you have to like do 60 hours in 3 years. And these 60 hours are divided into like 48 hours are clinical and 12 hours are theoretical. So this means not like the CDE points. If you are a dentist, a fresh graduate, you can do an implant course, right? So once you are doing the implant course, you are in 3 years, you are covering these 60 hours, right? Okay, now you want to do aesthetics. You can do aesthetics and you will get those CPD points, continued professional development. CDE points are only valid in India. And the CPD
Okay.
points, there is a list of courses that even you can go to places like Italy, you can go, or Greece, you want to do smile designing, you can go to South Korea.
Yes, so that's what I wanted to ask. I attended one implant course in that many Australian dentists, Indian dentists came at Kochi,
Yeah, yeah,
and
yeah, they
that
do.
was the collection of
E-
these
e-
points from
Even I'm
Perth. They
planning to
came.
do, yeah, even I'm planning to do the same. Also visit my family and on the expenses of the organization, I will be meeting my family too and doing the course at the same time. So it's a very wonderful opportunity, and the Australian authorities they make sure that you are constantly in touch with the new techniques. So it's really
And
helpful, and
sir,
it's
yes, sir. And sir, after getting Australia this dental council license, can we work in New Zealand also, or
yeah,
it's
you
different?
can work in we can work in New Zealand and Australia. These two countries you can do, and even in Tasmania is also part of Australia now. So Tasmania, Australia, and New Zealand, you can work over there. But I would recommend Australia is better because New Zealand is like very beautiful, very nice country. But the pay over there, as compared to Australia, is not that much. Moreover, the taxes in New Zealand are more. Like even there, the taxes are around like 50%, and the pay generally is not
And
higher. Like
sir,
they make sure that you
and
do
sir,
not cross 1.5. Sorry, Dr. Shraddha.
sir, just I'm interrupting. I'm really sorry. Actually, I have
No,
so
no,
many doubts. I wanted to
no.
ask that after getting Australian dental license, what about Indian dental license?
That will continue. Even you will be
Okay, like
holding the
if we
same.
want to come back to our country, anyhow, we are not liking staying in Australia. So if we want to come back, we can still practice, come back and still practice.
Yeah, you can still practice, but I will. Let me reassure you, you are not going to move back. I came here only just to like see around to
Also, you
make
have the family,
friends.
but we will be leaving our family in the country. That is the main concern for
Yeah,
female.
you will love it over here. Once you're busy, like you will enjoy it, Dr. Shraddha. No, no, like second question about that. Because the environment
And
is
so,
so good. Yes, yes,
and my
Dr. Shraddha.
husband is physician. My husband is physician,
Okay. Oh,
MBBS,
that's a
MD.
MD. Wow, that's really good.
He also have to
MD,
study
MD in which?
medicine.
No, MD in which like MD medicine. Okay. So my brother
Medicine.
is also
Mhm.
MD pediatrics, right? So what they did
Okay.
was they took the and
Mhm.
my bhabhi is like she's emergency medicine. So what they did is they took ADC part, AMC part one, and there is a specialist pathway. But before that, my brother went to UK for MRCPH, and
Yeah, they
after
have to
doing
go for MRCP, no?
Yeah, once they're done with the MRCP, then you will be like, now my brother is right now, he's over here for the last 3 years and now he's a consultant. So like
They
there
have
is a
to,
specialist path.
yeah, they have to go for part one, then MRCP.
Yeah, I'm not sure like they have to go for the
Okay.
part one or not, but there is a specialist pathway for GPs. I guess there is one exam that you have to write, but it's not that difficult, I guess. Hello, sorry.
Sir, some others mic is on.
Sir, I have a question.
Yeah, sure.
Sir, do you think it's worth, some of my seniors, they went for random course, and
Mm-hmm.
then during that course, they gave their dental exam and they succeed. So do you think it's worth the investment?
Well, it's very subjective to answer, but what I have felt in my like right now, are you practicing, Dr. Vasha?
No, sir. I just finished my internship.
Okay, you just graduated. So, Dr. Vasha, this is the best point because uh,
Sir, excuse me, Daniel Hashmi's mic is on.
yeah, Dr. Daniel Hashmi, can you please put on yourself on mute? Dr. Hashmi, uh, can you please put Dr. Hashmi on mute? Dr. Vinisha?
Yes, doctor, we're planning. We're just about to do that. Just give us 2 minutes.
Okay. No worries. I guess she's on mute now. So Dr. Varsha, the thing is like, sorry, I forgot your question. Can you repeat?
Uh, Sir, I have seen my seniors, they went for some random course to, to get into the country.
Yeah,
And then
I got,
during that,
I got,
yeah.
I got your question. So, Dr. Varsha, if I may say, see, this is a very subjective question to answer. Because when you are doing a course over here, first thing, you will be investing around like 40 to 60 lakh rupees into that course. Second thing, there will be very less financial help from your family because you will not be asking for that help. And to meet the expenses, because if you normally have to live into Melbourne, a city like Melbourne, right now the room rent for 1 BHK in CBD Melbourne is around like $2,500 per month. Over that, you have to earn money for like your livelihood, like for your food and everything. So it's around like $4,000 a month. It's a lot. So you have to work extra hours to get those money, right? And also you have to visit the university. And out of that, you have to chalk out time for your preparation. That's a lot of things. And moreover, if you are doing that course, you are investing somewhere around 40 to 60 lakh into some course, which is not going to be helpful for you, or you will not be doing anything with that in the future after 2 years. So those 40 to 60 lakh rupees are completely wasted, right? So what you can do at this point of time is if you can invest like some around 3 to 4 months into dentistry, into this competitive exam, then what you can do is you can clear the part one and investing some other money, some additional money, and the whole expenses will be around like 7 to 10 lakh rupees. And in that, you will be clearing the exam, right? Moreover, you will be investing a lot of
Including,
time and
sir,
energy into yes,
yes, please, sir, continue.
sorry.
So you can
No.
proceed.
Is there any question? So I was almost done that in 7 to 10 lakh rupees, you will be able to like complete your Australian dental registration, right? And you will be moving to Australia anyhow. But if you still want to, and if you're exploring that, there is a possibility that you go onto a student visa and then work over there for like study over there for 2 years and then come back to the competitive exam. This option is only valid if you are like thinking you want to secure something. At least you have basic necessity in and in Australia. Like at least you get some job, like a dental, like a practice manager, or you will be acting as a MPH. That's a most dangerous course, I may say, because you have to do the ground surveys and everything, and it takes a lot of time. Or you are going for the MHA, ठीक है, hospital administration. So you will like what I think is it's very hard to get time out of it. You have to do like you have to have extra dedication if you are planning to do this. But it's still like it's still a feasible option. You can go if you think that as a backup, not as a primary objective. If your primary objective is to clear this exam, then I would say just wait over here in India for a year and you will be there as a dentist. You had any questions? Dr. Ibra has. Ramlan, he joined nursing courses simultaneously. Yeah, people do that because there is a surety. See, once there is a failure, no, then we have a fear that what if I'm not able to clear? I do not have anything at hand. So she might be in Australia at that point of time, and she might have thought like, let's join nursing course. If I clear, it's good. If I don't, still I'm as a nurse over there for the courses as well as exam. Dr. Tensi, 7 to 10 lakh expenses for the course as well as for exam. Well, Dr. Tensi, when I applied for even I was thinking of coming as a student over to Australia, and I applied for the Curtin University, University of West Australia, then a university in there was one in Melbourne, um, Duncan and Lathrop. So I have applied in these universities, and the fee of MHA or MPH at that point of time was around $72,000. That is roughly around 40 lakh rupees. So I don't think it was worth it. So I didn't go for the student course. And moreover, student life is very difficult over here in Australia. But if you are like willing to just settle down in Australia, no matter how, so it's a good option. Hello. Any other questions?
So talking to you, it's just a cakewalk to get Australian license.
Yeah, it is because see, everything needs some efforts, right? I'm confident because I have been through this like this competition, and I know like what they ask, what they expect us to do, right? So what is the difficulty level? What are their patterns? So once you know the whole scenario, now, like see if you go to your house on a bike or on a car, the route you know, you will be very comfortable with it. You will be knowing, oh, okay, from there I have to move left and then we have to go to right. And then there will be a bump over there. Then we have to have the speed breaker and you will be at your destination, right? So you are very comfortable with it. But when you go blind, then you are very scared. You will be like, I don't know what's going to happen. So I am comfortable telling you guys because I have done courses, I have taught students, I have helped them. I've been through the same journey. So I know it's not a big deal. It's just a matter of hard work. And second thing is luck. Sometimes I've seen some very good candidates. They do not have the luck on that day and they fail by one or two questions. But they do not lose the hope, but they stand up again and they clear this exam. These exams are made like they need Australian dentists, right? They need international dentists in Australia because they have shortage of dentists. So these exams are made in such a way that we are in tandem with what their ideologies. Once we are in tandem with their ideologies and we are in harmony with them, we will clear this exam for sure. There's no doubt about it. And I will be very happy if you like if I can help you with that. And surely I will do that.
Thank you, sir. We won't be studying today.
Well, today it won't be it was just like Dr. Kunal and the academy asked me like they had a lot of questions. The students do have a lot of questions. Please address those. So today we planned that we will be having only these conversation regarding any kind of doubts the students have. So once everything is cleared, we will start with a proper framework because I have given them a lot of uh, material study. We have some materials and we are modifying the materials at the moment, and we will be making the PPTs out of it. And the questions, what I have with me is we are modifying them, which have been like up to the date, like this March, the recent exam that happened. So we are updating all those questions, or everything, all the options that were in those questions, and any minute details that were there. We are doing those.
Sorry to interrupt you, Dr. Ankush.
Yes,
Doctor,
doctor.
regarding this study material, Doctor, what you were asking, one day we'll be organizing a mock day where we'll be
Oh yeah,
having all such questions, and that will also be free for the participants who have joined today, just one single
yeah,
day.
yeah,
So that day we'll be
yeah, yeah,
providing the material and everything.
yeah, yeah. Sure, sure, doctor. We will be doing that, and
Thank you, Kunal
we
sir.
will be,
Okay, okay,
we will
Doctor.
be do we will be doing that, and surely they have joined and they are showing the interest. So what we can do is we can surely do something best for them, and we can organize one mock test so that they can understand what kind of questions they are having. And one more thing was like we are making that website for this now, as this is a now making website is very important, I guess. So what we can do is we can make a library over there and share some information, and anyone who wants to visit, they can go over there and see what all is required. So if they want, if more students join in, and what we can do is we can organize a session that will be totally dedicated on like what ADC wants. So I guess that is the most important lecture. What I believe is what because once you understand what they want is, then you can do exam easily. Part one is easy if we write from India. Dr. Ibra, it's not like this. Whether you write from New Zealand, Australia, or India, the questions will be same. But they again the same thing that these are the tell stories. Like one who hasn't qualified, they just want to justify the failure. I'm not against them. I'm not like it's a practical thing to say. Like it's very realistic about the things. So we try as a human. It's a human nature. We try to put our blame on other things. So, right, so I know where the question is coming from because this question has been asked from me like multiple times. So what happens is the questions are the same. So what happens is people who are not able to clear that, they make the story that if you take exam from India, they want more students from India. That's why they are clearing from there. But actually, it is not like that. If in India, I took my exam in Chandigarh. So in that center, there were only 6 students, and out of 6, 2 cleared that part one, right? But similarly in but similarly in Melbourne, there were 20 students. Out of 20, there were 10 cleared, right? So the ratio is more in the number of students who got selected is more in Melbourne as compared to India. But the percentage, if we see, so this is the thing. Oh, okay, that's nice. So you can take the exam from anywhere you want. Uh, Dr. Kunal, Dr.
Hello, sir.
Vinesha, would you like? Yes, yes, please.
So one last question regarding the question I asked earlier also. You said
Yes,
that
sir.
that 491 visa is there. After that, we can work in this. We have to work in suburbs.
Yeah, yeah.
Like suburbs means the colony. In some,
Well,
like in India, we have sectors or
yeah,
areas,
sir,
or they are villages. Like
yeah, sir, where are you from? May I know?
Delhi,
Uh,
Delhi.
Delhi. Okay. So, suburbs are like if you are in Delhi, if you are like in Janakpuri, say, right? So the suburb will be
Okay. Hmm.
Dwarka 15, Dwarka Metro, right? Dwarka Mode, like that. Like it will
Okay.
be around
Okay.
30 to 40 kilometers drive from the main city.
Okay. Okay. But not the village.
Yeah, and not the village. The suburbs are more like Chandigarh.
Okay.
Similar, almost similar, like Chandigarh.
Okay. Thank you.
Mhm.
Thank you.
Majority of the population stays in suburbs, and in city only there are offices. And those who are single
Okay.
or in IT sector, they only stay in the cities.
Okay. Okay. Thank you. Thank you.
No worries, sir. Any other question before I hand it over
Sir,
to Dr.
just
Kunal?
a doubt with Dr. Kunal and you, sir, as well. Since if we consider
Mhm.
March as date, so we have to really rush up and brush up for the things if we
Yeah,
are
we are
really
start.
serious for March.
Dr. Shraddha, the first thing we have to do is we have to do the initial assessment, right? Once the initial
Yes, sir.
assessment is done, right? And you can do it in a one in like 15, 20 days. You can start
So
the
who
process
will
and send
guide
it.
for that initial assessment also? Like I said, I have tried a lot, but I'm doubtful about my college and all
Uh,
those things.
Dr. Shraddha, we will see like we need to send a mail to Australian Dental Association for that because they are the right authority to answer on these things, right? Uh,
Yes, sir. So Kunal sir will
so
help us.
yeah, Dr. Kunal or the academy, you just we have your query with us now, and we can help you with that. We will like discuss about this, and I will also ask about from some of my colleagues if someone is aware of that. But I believe like I have seen a lot of students from Moradabad who have been taking these
Yes, there
exams.
might be, yeah, many private colleges students are going, but still to make sure, then we have to be mentally prepared that now another 4 months we are into this learning phase
Okay,
only. So things has to be
yeah.
hurried.
So can you have you seen that on which site you have seen that your college is not registered or something?
AGC only. I inquired on ADC, then I opened that global college list.
Okay.
Maybe in that I didn't find my university, Royal Fund
What you can do
University.
is you can alternatively you
I'll
can
write
also
to
contact your
Kunal sir.
university.
Yeah, I'll write to Kunal sir, then he can correspond me back.
Yeah, sure, sure. What you can do is you can alternatively connect to your university. There is a clerical staff, right? They are responsible
We don't
for
hope anything from these Indian universities.
yeah, that's the sad point of it. But still, if you can write them a mail or contact them if someone has applied for the transcript to Australian Dental Council. From that, it will be clear like your college
And
was in
yes,
the
sir,
list or
one
not.
more document that is needed is good conduct from DCI.
Yeah, that is you can go to the to the DCI or to the any like I was registered
Yes,
in
sir,
Punjab
matlab, like
Dental
these
Council.
documents are time taking and they have to be done on time for March exam.
Yeah, it will take around like a week. That's why I said like if you start the process right now, it's going to take around like 15 20 days to do the initial assessment, like all the documentation, everything. Once you're like you have to be on your toes for 15 days for the initial assessment. Once you are done with the initial assessment, then you can start with this like course. So what we are that's why we are conducting these sessions in this in August because September mid they are having the exam, and the new courses are going to start at the end of September when the result is out for or at the mid of right. So October, right? So October new sessions will be starting with all the institute everywhere, right? So that's why we are conducting the session right now, so that if someone is going for the initial assessment, they can go for that. and then we can start with all of these things. Right now, we are only taking the mock tests at this point of time. We are not starting any
Doctor,
theoretical classes. Yes, ma'am.
Doctor,
Yes, doctor.
before finishing the session, should we share the details of the packages we are offering?
Yeah, doctor. You can share that.
Yeah, okay. So doctors, we have three packages here, three modules. The first one is mock test series, which is the duration for that will be 16 weeks. The fee for that will be 28,000 only. And the second module, which covers study material discussion classes, duration again same, 16 weeks. The fee for that will be 44,000. And the third module, which covers lectures, study materials, complete study plan, mock series, discussion classes, and doubt clearing sessions. The duration 16 weeks, and the fee for that will be 58,000. Yeah, this is the only this much.
Okay, thank you,
Ma'am,
ma'am. Please send it on our personal WhatsApp also so that we can coordinate.
so we can do one thing, ma'am.
Sure,
What we
doctor, I'll
can
do
do is
that.
we can make a group, right, for our institute, either on Telegram or onto the WhatsApp. So we can add students over there, and we can send these details in one go so that everyone is aware, and they can join accordingly. How does this sound, Doctor? Dr. Vinisha?
Yes, doctor.
I was of the idea like let's make a group on WhatsApp or Telegram, and we can send all
Yes,
the
doctor.
details over there and all the questions
We are
because
comfortable
uh,
both on the WhatsApp also and this Telegram also.
I
I think
would
Dr.
say
Kunal will tell when we are starting the batches. Doctor, please, can you please share the details? When are we planning to start?
Doctor, right
Dr.
now,
Mosti, yeah, sorry.
yeah. So okay, I thought Dr. Vinisha is asking for me. Go ahead, Dr. Kunal, please.
Yes, I think this question have come up that when the batches will be starting. So, Doctor, the batches will be starting in September. The dates have not been fixed yet, but we'll give you the confirmation dates and we'll be starting it in September. To all the participants who have joined us, we'll send you the dates of September when it gets confirmed within a day or two.
Yeah, doctor, that would be perfect. Any other question? We have.
Sir, regarding the course, like the classes will all be online, or we have to come to the center
Uh,
at Janakpuri?
well, doctor, what we are planning right now is there are three packages, right? So in we are also including right now is which no one else is doing. We will be including the theory classes that we
Okay.
will be conducting in a weekday. Like it will be a 2 hour or 3 hour class, and it will be specifically directed according to the ADC, and we will be dispensing information regarding the same, right? And on the Sunday,
Okay.
we will be having two sessions, one in the morning,
Okay.
and then we will be giving 2 hour break, and again there will be a 2 hour session because we are
Okay.
selecting Sunday because everyone is free on that day. And what we
Okay.
can do is like in during those phases, we will be discussing about the scenario based questions. In that,
Okay.
we will be like training ourselves in such a way that to know which option to choose, why we are choosing this option, why we
Mhm.
eliminating the other option. So
Okay.
on Sundays we will be doing that. For example, if we are we are planning to do endo, suppose in the week
Okay.
one, we will be
Okay.
taking a theory class regarding endo on like any weekday. We will decide either Wednesday or Thursday morning, evening. We will decide. So we will be taking a theory class,
Okay.
and probably it will be either early in the morning or it will be after 7 o'clock because when everyone is free. And we have
So
to
it
also
it will
see.
be online only, na?
Yeah, online, and it will also be recorded and uploaded onto the website. So we are developing that thing at the moment so that if you by chance if you miss a lecture, you can go to the
Okay.
website or you can send us a mail requesting the access to the video lecture, and you can access that video lecture when if by chance you miss any of the lectures, right?
Okay. Okay.
Yeah.
And the first was the only the mock test that was around 28,000. Like in that, what will be there? Only tests will be there, like
Uh,
and
yeah, doctor,
brick.
there are three pack. What we have
Yeah.
devised is there are three packages. The one package I've
Okay.
told you, like it's theory classes. In that there will be theory classes, there will be
Okay.
explanation of the questions and the mock test.
Okay.
These three
Okay.
things will be there. In the
Okay.
second package, what we will do is there will be only Sunday discussion and the mock test.
Okay.
And in the
Okay.
third package, there will be only mock test.
Okay. So
Yeah.
mock test will be like in the exam pattern only, like
Yeah,
2 hours
exam
in the
pattern.
morning. Yeah.
No, it will be like giving you the like there will be 14 scenarios. 14 scenarios we will give you in one go. That
Okay.
will be in the like one part is like in like I explained, like on Monday there is 2 hours exam and then 2 hours break, then 2 hours, right? So in
Yeah.
mock test, what we will do is only there will be one test, 14 questions, right?
Okay.
14 scenarios. So 14
Okay.
scenarios you will visit, only one session will be there, right?
Okay.
And like
Okay.
this, we will be having, suppose you are doing course with us or you are not doing course with us. So what is the
Okay.
thing like if we have covered endo and perio,
Okay.
right?
Okay.
So we will be taking the mock based on endo and perio only,
Okay.
right?
Okay. Okay.
Then once the whole syllabus is covered, then there will be
Okay.
four mocks that will be covering the whole syllabus. Like in
Okay.
that, we will be asking random questions from infection control, from
Okay.
oral surgery, from perio, from endo, from any other subject that will be there, right?
Okay.
From OMR, from we will be sending you the X-rays, like what you see, what is this um, anatomical
Okay.
structure that you see in X-ray. So like this, there will be questions.
And if I do join for this mock test wala, that costs around 28,000, will I be getting the material also to study all the material which everyone else will be getting who will be doing the more better?
No, sir.
Like,
No, sir.
yeah.
The material will not be. I'm not sure. Like that academy has to decide. So
Okay.
there will be question like I will only be making the mock test and will be like putting it up, and
I can't
they will
hear
Okay.
be
anything.
monitoring.
Okay.
Sorry. Okay, so we will be doing that.
Okay,
Rest
sir.
you can confirm with the academy, and they will guide you accordingly.
So mock test will be once in a week. A 2 hour
Uh,
will it will be of 2 hours, and like whatever
yeah,
subject has been covered in that week, that questions will be asked. Like the way we get in our exam, 70
yeah, yeah,
questions in 2 hours, it will be like that, but only on that particular subject that will be covered in that week. That's what
yeah.
I've
Exactly.
understood.
Like it will. Yeah, it will be like we will be giving 8 mocks, right?
Okay.
So the four
Okay.
mocks will be the whole syllabus mocks, right?
Okay.
And the four
Okay.
mocks will be like we will like join the subjects like endo, perio, and OS. Suppose,
Okay.
right?
Okay.
So the
Okay.
one mock will be from them. One mock will be endo,
Okay.
perio, OS, and prosto, and another. So like this, we
Okay.
will proceed. Or what we can do is like we can one mock dedicatedly endo, one mock
Okay.
dedicatedly prosto, one mock dedicatedly something like this, right? So we can do
Okay.
this easily. But 4 mocks will be whole syllabus.
Okay. So total in that course we'll get total 8 marks in those
Yeah, 8
16
mocks,
weeks.
and out of those 8 mocks, the three full syllabus mocks will be 1 month before
Okay.
the exam. Because in
Okay.
the
Okay.
last month, it's very important, 3 to 4 mocks. Like you
Okay.
have to have that your mind conditioned in a way that you need to answer these questions, and
Okay.
like without book or anything else, you have to dedicatedly sit for 2 hours and
Okay.
conduct to take that exam.
Okay.
Yeah, doctor.
Okay. Okay. For more details regarding the courses, we can contact the academy. Yeah.
Academy. Yeah, yeah,
Later.
sure, sure.
Later we can contact.
Yeah,
Okay.
yeah, later you can contact.
So just one more doubt, like exams we will be coming to Delhi and give or at our centers, like in Aligarh
Uh,
or something.
No. That will be conducted on your personal, like we will be taking through the mock test. We will make mocks and we will send you the mails, right? You can open it like we will on at your home. You can open it and you can take it. There will be a window like from morning 10 o'clock till afternoon 2 o'clock. You can take any time in between, right? So you can take that mock at any time at
Okay,
your
so
home.
that happens with ADC only also.
Yeah. Oh, yeah. The ADC exam, when you are going to take the ADC exam, that you have to go to the center. But this exam,
That's
as
what I wanted to ask. We have to go to particular center for that.
for ADC, yes. For ADC exam, when you are taking the exam, there are Pearson PT centers, right? Pearson centers.
Okay.
There you have to take that exam. But with us, we are giving you at like you can take at your laptop, computer, or mobile phone. Any other questions? And even if you like, if you want another session, like we can arrange it in few days. And what we can do is we can make sure that we do that regarding the what ADC asks for, or like what how to start with the initial assessment. We can also do on that if you want.
Yes, so we can have like we will be again searching ourselves and we'll be having more doubts. And
Yeah,
one
sure.
more I mentioned, like we are well settled. I am well settled in India with central
Mhm.
government job. So is it right to go for ADC? I'm still confused.
See, doctor, what I've felt over here is like, see, in the future also, like my planning was like my family whole moved here. So my brother had he started his own family. So he was of the idea that in the future I have to move to Australia because he wanted to give a better life to the next generation and also the best of education, right? And we know that the universities in Australia, they are in the top 20, top 50s. So keeping that in mind, he moved to Australia, and I moved to Australia, keeping in mind my family is over here. But right now, I'm feeling like it's the environment is better, the air quality is very good, the people are good, the education system is good. The people over here are law-abiding citizens. There's almost zero crime that I've seen till now in Australia. So it's overall it's very good environment. India is equally like it's clean, it's everything is there. But still, there is no work-life balance in India. There is a lot of politics and there is no work-life balance. If you want to enjoy like the earnings, then I think it's a good place. It's a good place. Mm.
Okay, sir. Thank you.
So, Dr. Kunal, do you have any information to share, or Dr. Vinisha? I'll be handing it over to you. I guess there are no other questions, and
Sir,
if they
one,
do have, yeah,
sir,
please, doctor.
one last question. Like, if we give the theory in March and if we do clear
Mm-hmm.
it in first attempt, and
Yeah,
are we eligible for September practical also, or we are
yeah,
eligible
sure,
for
sure,
March?
sure,
We
doctor. You
should
will
give or
clear
not?
in.
That is a different thing. We should give immediately practical or not. But if we do clear theory in March,
Doctor,
we are eligible for
no.
September 24 practical.
Yeah, doctor, you are eligible to take the exam in like the first 6 months. So
Okay.
the primary thing is there are three things that are asked in the like part two. So the one is the
Okay.
tactical part. The tactical part, as you are practicing over here, like you will require like 4 to 5 months practice, and you will be there,
Okay. Okay.
right? So there are 32
Okay.
activities. There are crown
Okay.
cuttings, but crown cuttings
Okay.
are the PFM ones, right? So
Okay.
they are
Okay.
till the like level they are followed what is written in the book, in the Proster books, right?
Okay.
Almost
Okay.
similar things. So there is
Okay.
amalgam restorations. There is a complex amalgam restoration that will be MOD ML missing. It's a
Okay.
mesial occlusion distal and the mesolingual cusp will be missing. Or there will be
Okay.
1626 in which
Okay.
there will be MOD and the mesobuccal cusp will be missing. A very large
Okay.
cavities will be there. Then there
Okay.
is a endoaccess cavity. Then there is caries and the molar caries, right? So there are special
Okay.
teeth that come for these that are available at one dental in Australia.
Okay.
Then there are scaled OSCEs. Scaled OSCEs include the scaling, CPR.
Okay.
Then we have that extractions. We have
Okay.
patent fissure sealants. We
Okay.
have X-rays, right?
Okay.
So
Okay.
these are the things in that. And finally, we have the communication OSCEs. In communication OSCEs, we have communication like there will be three people, two examiners, and one will be you as a student, as an aspirant.
Okay.
So
Okay.
one examiner, suppose if I am one of the examiners, I will be acting as a patient and I will be
Okay.
communicating with you. And there will be a
Okay.
third examiner who will be judging you on the basis of communication. So if
Okay.
you can prepare these three things in 4 months and you are very comfortable with them, then I would say
Okay.
that you can go for this exam in within 4 to 6 months. And
Okay.
many of students have done it,
Okay.
but you have to do like extra efforts you have to put in.
Okay. Thank you. Thank you.
No worries, doctor.
I guess academy will help us in part 2 also, communication skills and etc.
Yeah,
etc.
yeah, sure, sure. Look, academies, yeah, they will help you. Everything will be like done in a systematic way. Don't worry about those things.
Dr. Ankush, can you hear me?
Yes, doctor.
So thank you so much, Dr. Ankush. I would first
Uh,
of all thank you for taking out time for today's session.
Thanks a lot, Dr. Kunal, for giving me the opportunity. And I really felt good after long we are conducting the session together.
Yes, and I really hope for all the participants it was informative. Yes, definitely there are many doubts that will still come up, but yes, the academy is there. You can directly call or text us for further doubts, and Dr. Ankush will be in future also for the courses and everything will be helping you out. Will be taking the classes, and a few things that was noted during the session today. So the theory, yes, that would be online. So you don't have to come to the center for that. For the practicals, everything will be arranged. It will be offline, and that will be arranged at the academy. Our academy is in New Delhi, India. It's in west part of Delhi, that's Janakpuri. So we'll be sending you the address and everything. So part two would be conducted there. Part one will be conducted online. Next, within a few days, we're planning another 10 to 12 days for all the participants who have joined us today and many more who will be joining. We'll be conducting a free mock also, where a few questions and materials will be discussed. That will be again taken by Dr. Ankush. So you get the hold of the questions and scenario based things that day. After that, we'll be starting with the enrollments. Normally, before every batches, we give a free trial session and special discounted packages are given. Later on, of course, the fees get increased. But right now, for all the participants who have joined us today, there's going to be special packages that we'll either send it to you on WhatsApp or the Telegram. We'll be making a group for that. The new batches will be starting in September for the theory. But yes, the dates are not confirmed yet. Within a day or two, we'll be confirming the dates also. So thank you everyone for participating today. Looking forward to your participation in future as well. We hope you really like the session today. Thank you so much, doctors. Thank you.
Thank you,
you,
sir,
everyone.
for this free doubts session. Actually, this was much needed. And after this only, we are thinking of maybe in a year we will be a Australian dentist. So, Dr. Kunal sir, I've been following you. We don't know each other personally, but I have been following you through Facebook. That's how I come to know, and I'm really expecting you'll help us in sailing this track.
Don't worry, doctor. We will be helping you in all the possible ways, and Academy is always there to help you.
Yes, doctor. As initially Dr. Ankush told you, it's more about the helping part to each other, the fellow dentist. So the whole team is working day and night for this only. All the team members, the lecturers, Dr. Ankush, Dr. Vanisha, and other members also. So definitely, we will be hoping that it is productive, it is fruitful, and it helps our fellow dentists to get help in future. And we would love to see you in working in Australia.
Thank
I
you,
guess
Dr.
Doctor.
Ankush, also.
No worries. Dr. Ibra has a question. Doctor, can you for information, please? Yeah. Dr. Ibra, please contact the Academy regarding the duration. It will be generally 16 weeks.
Doctor, I've shared the contact details in the chat box so that they can directly contact us.
Okay. Okay. Okay, ma'am.
Okay,
Doctor,
so we
another
shall
question.
Yeah, sure. We can call it a
I
day
think
now, and
Dr. Ibra
we can
wants
plan
to
for
ask
future.
something.
Yeah, sure. Dr. Ibra. Dr. Ibra, for part 2, you can contact the Academy, and they can help you with that. They can inform you, like, they'll, what is the duration they are planning to. Okay, thanks everyone for coming in today and asking a few questions. It was really wonderful, and hope to see you soon. Okay, take care. Bye bye. Good
Thank
evening,
you, Doctor.
everyone.
Thank you so
Bye.
much, Dr. Ankush. It was a wonderful session and very much informative. Thank you so much again.
Thank you, Doctor. Bye. Take care.
Oh, okay. Have a nice day.
Have a nice day.